This is Dr. B. Murali Mohan, consultant intervention pulmonologist and sleep specialist at Reno Hospitals, Kompally. Today I am going to tell about intervention pulmonology. Intervention pulmonology, minimally invasive procedure which includes bronchoscopy, medical thoracoscopy, endobronchial ultrasound and airway stunting. There are different types of organ plasma coagulation, laser are also involved in intervention pulmonology. Bronchoscopy. What is bronchoscopy? Endoscopic visualization of the airways. In this bronchoscopy, when a patient is having persistent cough for more than 6 weeks, or if a patient is suffering from any malignancy, if there is any non-resolving pneumonia, these are the common indications for bronchoscopy. It is used for diagnostic and therapeutic purposes. Diagnostic purposes to rule out malignancies, infections, and therapeutic purposes is to remove foreign bodies if there is any mucus plugging. In children also, we can use bronchoscopy to remove foreign bodies. There are two types of bronchoscopies, rigid bronchoscopy and flexible bronchoscopy. Most commonly, pulmonologists use flexible bronchoscopes. Rigid bronchoscopes is used by ENT surgeons. Nowadays, the usage of rigid bronchoscopy has increased in pulmonology in order to use laser, organ plasma coagulation or cryoprobes. Medical thoracoscopy. Medical thoracoscopy is laparoscopic visualization of thoracic cavity. In cases of undiagnosed pleural effusions, in case of mesothelioma and in case of recurrent pleural effusions, we use medical thoracoscopy. It is done under local anesthesia. A surgical incision is made at the site of the pleural effusion and thoracoscope is passed and biopsy is taken from the pleura and sent for histopathological examination. Talc is commonly used for pleurodosis. Endobronchial ultrasound. Endoscopic visualization of the mediastinal lymph nodes with using sonography is the advanced technique. It is used in detecting early stages of lung cancer and also in staging of lung cancer, taking biopsies and FNACs from the mediastinal lymph nodes. Next is airway stunting. Airway stunting is done in cases of extrinsic compression of the airways or if there is any mass in the airways. So, in order to rule out any malignancies, first, if there is any endobronchial obstruction, the mass has to be removed and a stent has to be kept. There are different types of stents which includes for benign lesions, silicone stents are used and for malignant lesions, metallic stents are used. Nowadays, hybrid stents are being used. Generally, we hear stents in cardiology, but in pulmonology also, there are different types of stents, inverted Y stent, J stent. So, depending on the pathology, we select the patient and we go for stenting.